I am Heather Eliassen. I am a professor of nutrition and epidemiology and focus on cancer epidemiology. I had a bit of a circuitous route to cancer epidemiology, given that I was a history major and a studio art minor in undergrad. But after college, I worked in an asthma and allergy clinic on an NIH-funded study on kids with asthma. So I decided to pursue my graduate degree in epidemiology and shifted my focus to cancer as a master's student at the Chan School. The main thing that's driven me to pursue cancer epidemiology is to reduce the burden of cancer by preventing it from occurring in the first place. So many of us have a personal connection to suffering that cancer causes, and this underlies a lot of the passion that I have in working in cancer epidemiology. I mainly study breast cancer, and the focus of my research is really trying to understand ways in which we can prevent breast cancer and also improve survival among women who've been diagnosed with breast cancer. So I'm interested in aspects of lifestyle, trying to identify modifiable factors that might reduce the risk of breast cancer. So some of my work, I've examined patterns of diet and lifestyle exposures among women, and then try to understand who subsequently develops breast cancer versus who does not. So some examples of this include understanding the role of weight management, physical activity, and diet in reducing the risk of breast cancer. So we found that women who are able to avoid weight gain after menopause are at a lower risk of breast cancer compared to women who gain weight, which is a common pattern. And similarly, women who are physically active after menopause are at a lower risk of breast cancer. And one of the things that I love about these studies is the message that it's really never too late to change your lifestyle to impact breast cancer risk. So integrating both the biomarkers and modifiable factors, I've found that women who have higher blood levels of carotenoids, which are antioxidants that are found in colorful fruits and vegetables, are at a lower risk of breast cancer and particularly more aggressive forms of breast cancer. So I've also explored my interest in modifiable factors among women after breast cancer diagnosis. And we see that a better diet and more physical activity also contribute to better survival after a diagnosis of breast cancer. When I was applying to grad school, I knew that I was interested in chronic disease, and cancer stood out for me, given lots of personal connections and knowing how much of a burden it causes. And then HSPH as a school stood out for its impactful research in cancer epidemiology. And in addition, the people in the school community, the fellow students and the faculty contributed greatly to my choice to come to the school. It seemed that everyone that I met was passionate about what they were doing, passionate about sharing their excitement and their expertise, which all contributed to just a very rich learning environment, first as a master's student and then as a doctoral student. And as you can see, I have never found a good reason to go anywhere else, so I am still at the school. Well, the thing I love most about my job and that I love most about being a student is the people that I get to work with. So there are so many wonderful collaborators and supporters and champions of public health. And I definitely count myself lucky to be surrounded by people who make the environment so rich and so rewarding. And the students and postdocs that I work with now play a big part of this community environment as well. They're smart, they're engaged, they're passionate, and they're really dedicated to making an impact in cancer epidemiology. The people and the resources. So these are definitely what make the program at HSPH unique. It's a community of staff and students and postdocs and faculty who are all here to make the world a better place through their dedication to public health and specifically to cancer epidemiology. And another factor, I think, is the resources that we have to help answer tough questions in cancer epidemiology. So I now lead the Nurses' Health Studies, where more than 200,000 women have contributed over decades to help us understand how aspects of diet and reproductive and medical history and lifestyle contribute to health and disease. So these aspects make this a very outstanding academic environment. I think I would come back to the community engagement and collaboration that allow us to sort of make the most of one another's strengths to work towards a common goal of improving public health through cancer epidemiology. And in this case, the whole truly is greater than the sum of its parts, and it's the entire community that work together.